I can't really tell you even what triggered all of it. I don't know what started my alcoholism to get to where it got to be. It just spiraled. It started with, 4 drinks here or there, and the next thing I know, I was 24/7, 365 days of the year for 4 years. I spent time in a treatment facility close to Sioux Falls. And there I spent 30 days in sobered up and went through all the necessities as far as the AA and doing the things that I needed to do. When I left there, I felt that was a really good place. But 2 months later, I ended up relapsing. It was an awful night. I felt really down. It was one of the darkest days I've ever had in my life. And I felt I had left everybody down, let my family down, and that all the things I had said so highly of myself or thought so highly of myself coming out of treatment, you feel so big and boisterous and I accomplished this great thing. But when I got truly out into the real world, it was scary, very scary. I was on some anxiety meds and I decided that taking those anxiety meds would be the best thing for everybody. So I downed them all and I was ready to die.
Depression makes us feel as though we are a burden to everybody else around us. And when you ask me that question, what I think is that that's the depression speaking. They are literally convinced that their family would be better off with them and that indeed they are doing their family a favor. And that by prolonging things, that they truly are just remaining to be a burden to their family.
For people to sit there and say, how, Lisa Larson, why would you want to end your life? When you get in that dark, lowest point of your life, you really, truly do believe life is better without you, and you're doing them a favor. And thank goodness, it didn't happen. It didn't work. So I was rushed to the hospital, and there I spent a day in the ICU. Because of my suicide attempt, they ended up sending me over to Avera Behavior Health, where I spent 7 days there. And those 7 days really changed my life. They provided me skills and tools and other resources that I could use that would help me to stay strong and stay focused on what was important.
Following hospitalization, we very much so target crisis management. We have a lot of therapy, both individual, group options. We also obviously do a psychiatric evaluation, and if treatments are recommended, those will be offered to the patient as well. Not only are there services inpatient, but we also spend a lot of time setting up anything that needs to be done on an outpatient basis as well in order to offer them the best chance at recovery and success. Depression is a diagnosis that they potentially could have again in life. It doesn't mean they will. Some people it's very chronic persistent. Some people may only have 1 or 2 episodes. Some may have many reoccurring episodes. So very difficult to say, and that's very individualized.
When they say that 1 day at a time, it really is 1 day at a time. A lot of times it's 1 minute at a time. There's places that I go that trigger back the smells, the feels, the tastes, whatever it is that could easily just take me right back to that place where I was 13 years ago. But every morning I wake up and just have to prepare myself for those things, and then just be prepared to get away if I need to and remove myself. When I run, I feel all of my thoughts get organized. The mental health and physical activity component together, they connect so well. You find that strength, then you find that confidence and everything else, and then you start feeling good about yourself, and then you can share your passion on top of it. And so when I was approached to run and be a part of the 437 Project, I was nominated by a local gal. So she knew me from a community involvement, that I was a go-getter, but she did not understand the whole mental health atmosphere and history behind me. My heart was telling me, if I'm going to do this run and I'm going to be a part of this project, I have to be open and honest, and I need to share this with others. So I told my oldest son, who was 24, and his fiance, and they were shocked, but very proud of me, and that was really cool to feel their love and their support. And then 2 days later, I had an interview with the local newspaper, and they were asking, and I was like, I need to share it. I need to share it to the world. I need to tell them. And I've been telling it ever since. So when I got up to speak the very first time when I introduced myself at the 437 Project, that is where I truly stated it out loud to the public. So in front of the Avera Behavioral Health, which is really where my 13 years started. So it was meant to be. It really was meant to be, and I know that. And so I'm very thankful for the courage that I've had to share it. And I do know it is making an impact. And my boys are proud of me, and my family's proud of me. I had a lot of support, and I still do.
Lisa's one of a kind. I did have the opportunity to run the 437 Project, so running across the state with her and getting to know her. She truly brings the best out in everybody around her, and her zest for life is absolutely contagious.
As we're running the run, it is, and we're on the road. It's a big deal. We're going down and we're cheering, we're running through the towns, but those community stops were amazing. I think people see me as a strong, have my things in order, always organized, always happy and stuff. How could have Lisa Larson ever wanted to end her life? And so speaking up there and showing that it does not discriminate against anybody. You can have the happiest of happiest lives and you still have thoughts. The 437 Project has spread awareness not only for the run itself, but the 988, the Helpline Center, the 211. Those things are incredible resources. And just getting that out there, knowing that that's what the 437 Project is really promoting is amazing.